Well, good morning, everybody. Nick Simonson taking over the C103 studios on this Friday morning. And joining us for our very special 10 a.m. community program, we got some folks from the Adams County Regional Medical Center. We're going to talk a ton of different things that are available at the Adams County Regional Medical Center, not just at their main location, but also at some of the family practices. And we're going to talk COVID because there's a lot of questions right now about vaccinations and how that's rolling out, who's eligible, how do you get it, does ACRMC, are they offering it? So to answer some of those questions, we're going to start with Rachel Cummings. Rachel, you're kind of responsible for some of this, is that right?
Unfortunately, no. Yes. There's a lot going on around here. I can't say that I do all of it. I have a lot of helpers that help keep on top of this. It takes a whole team of us to be prepared and keep up with all of this.
Well, especially with this vaccination rollout, we've had this pandemic going on for almost a year now. We're just a month shy of that milestone. And when we think about it, having this vaccine is going to help us get back to normal. So a lot of people are wondering, how can I get it? When do I get it? What can you answer for right now for the people that are out there and get that information out there to their ears?
Okay, well, it's a lot of information. So first, I want to just let you know that you can always go to our Facebook page to get additional information. But first of all, just to kind of let you know, we do have the vaccine available to us. It comes in allocations from Ohio Department of Health, and we are required to follow their distribution guidelines. So they tell us who we can give it to and what dates we can start doing that. And then they send us a certain amount of vaccines on a schedule. So I just want to make sure that everybody understands that we are required to follow those guidelines and we have to work within those. And so I know people want to get their vaccine as quickly as possible, but we have to follow those guidelines and we will get to everybody as quickly as we can with what we have. This week, January the 19th, we can start out with those that are 80 and older. So we had our first clinic this week and started doing some vaccinations already for that group. Next week, January the 25th, we can begin vaccinating those that are 75 years of age and older. Anyone with congenital or developmental disorders, we can also vaccinate next week. Then starting on February the 1st, anyone that's 70 years of older and employees of the K through 12 schools. Then the next week, February the 8th, the 65 and plus individuals are then eligible for their vaccine. And like I said, these are just tentative time frames that ODH has given to us, and it's all dependent on us receiving our allocation of the vaccine. And as soon as we get that allocation, then we start planning our vaccine clinics. Right now, if people want to get registered for the vaccine, we do have a phone number that they can call and leave their information. They would need to call 937-386-3015, and they may get a person during the day, or they can call any hour of the day because there's a voicemail that they can leave their information, and the message there lets them know what kind of information we need. We need their name, their date of birth, their address, and their insurance so that we can get them scheduled on our list. So regardless of when they're eligible for the vaccine, they can put their name on the list. And then as their age range becomes eligible, then we start calling people and letting them know when they can come to receive their vaccine.
So you guys are basing the schedule on how many people call and how much you have allocated in each of these different time frames to get people vaccinated, correct?
Right. So, we do an Excel spreadsheet with everyone's information in it. We can sort it by their age so that we know that we're vaccinating those that are in the appropriate age group first. And then we just work our way through that list and call people and let them know when they can come. Some people are getting themselves on more than one list. So if they get their vaccine someplace else, when we call them, then we mark them off of our list and we move down to the next person. So regardless of where they fall in that age range, they can put themselves on the list, and then as we get to their age group, then we can give them a call and let them know if we have a vaccine allocated for them.
Now, you mentioned that one of the pieces of information that you need to get from each individual is insurance information, and I believe that's going to be one of the major questions that people have when they're getting this vaccine is how much is it going to cost them?
Right. The vaccine itself is provided to us through taxpayer money. If you read the ODH website, it explains that information. However, the insurances help cover the administration costs. So just the time and effort and, the use of a professional to give the vaccination, that's what that small administration fee is. And that has also been set by the government, but insurance covers that. And if it's a self-pay person, then there's programs to help cover that fee also.
So there are help for anybody who wouldn't say have insurance, but originally we're thinking that people, over the age of 80 either already have insurance or are probably on the Medicaid or Medicare program.
Correct. So we don't want anybody to feel that they can't come and get the vaccine because of lack of being able to pay for that. That will all be taken care of. So if you qualify and you want to have the vaccine, please call in and get yourself signed up for that so we can get you on the list to get the vaccine.
Now, I've been hearing some rumors that you don't necessarily have to go into the hospital to get the vaccine.
That is correct. We have created our process so that the patient gets to stay in their car. Our staff goes to the parking lot and works that program out there so that it's very simple for everybody to get through there, because sometimes I know that, getting bundled up and walking into the hospital and going through the registration process and all of that is kind of cumbersome, especially to our elderly. And so we tried to come up with a way that we could make this very easy for everybody and that we can move people through as quickly as possible so that we can administer the vaccine as efficiently as we can.
Well, that's amazing, because I imagine that's got to save a lot of time for at least the people who are getting the vaccine. Not necessarily for you, though, right?
Right. It takes a lot of time and effort. But like I said, we had our first clinic yesterday and we did 100 vaccinations and it went very smoothly. And I think that overall the program worked the way that we had intended it. So as we go forward, there'll be a little tweak here and there to make it as quick and as efficient as we can for the patients, but I think it went very well.
Wait, did I hear you did over 100 vaccinations in a day?
We did 100 yesterday, yes.
That's insane. I can't imagine how many. You'd have to do like 10 an hour.
Yeah, something like that, 10 to 20. I think it was 20 that we did an hour.
My goodness, 20 in an hour? That's one every 5 minutes or even better than that, isn't it, almost?
Yep.
Wow. All right. If there are some other questions, too, that people have concerning, if there's still testing going on concerning COVID-19 for people who think they may have been exposed before they can get this vaccine. That's still happening?
Absolutely. So we have testing available not only at our hospital campus, but also all 3 of our off sites at the family medicine locations as well.
Well, that's how do people get scheduled for that? That's not like a drive-through testing anymore, is it?
Well, in a way, it is still a drive-through testing. You have to have an order from your physician, and once you get the order from your physician, if you come to the hospital campus, you pull around by the emergency room under the awning, and there's a phone number there that you call in and do your registration over the phone. Someone comes to your vehicle, collects the specimen, and then away you go. So that one is a drive-through, as well as at our off-sites when they go to our family medicine locations. If they already have their order from their physician, they can still come to one of our locations and they call in, same sort of process. They'll call inside, get registered, somebody will come out, do their swab, and then away they go. If they don't already have an order and they feel that they would like to be tested and that they qualify, they can have an appointment with one of our nurse practitioners who, after they do their screening, if they feel that it's an appropriate process to go through, then they can set them up to do that COVID testing as well.
Well, that's amazing. Well, I'm glad there's still testing going on. And, of course, the rollout of the vaccine, you guys are following all the rules, and you'll get to everybody as quickly as you possibly can, right?
Yes. Yep. We're doing the best that we can. We want to provide this service to our community and those around us. And like I said, we have to follow the guidelines, and we only have so much vaccine allocated to us. So, we're going through the age groups appropriately and following through with that. And we will do the best that we can to get everybody who wants to have that vaccine.
Well, of course, we want to thank you from the bottom of our hearts here at the radio station for doing all of that hard work and trying to get our community back to, some sort of semblance of normal once those vaccines are all properly distributed.
Absolutely. We want everyone to, consider if the vaccine is a good option for them, and if so, to reach out to either, there's other places also they can get their vaccine. They can reach out to the health department. They can always go to the ODH website, and it shows them other locations that the vaccination is available to them. But if they feel that that's what they want to move forward with, we really encourage everyone to get the vaccine.
Well, thank you so much, Rachel, for your time. I know you've got to be busy, especially if you're doing 20 inoculations every hour for COVID-19. We got to let you get back to that, don't we?
Yes, sir.
All right. Well, thank you so much, Rachel. And when we come back, folks, we're going to talk about restorative pain care and what that could mean for you. That's all coming up next here on our special 10 a.m. community program with the Adams County Regional Medical Center on C103. And welcome back to our special 10 a.m. community program here on C103. Once again, we're going to turn it over to Dr. Ned with the restorative pain care program that's new at the Adams County Regional Medical Center. Well, it's not necessarily new, Dr. Ned, right?
Well, yes. I mean, we have this is a new program here in this facility for us. We've been here for approximately 6 weeks now, and we're very excited to be here. And we have a great crew that's working with us, great crew of nurses and assistants, medical assistants, and healthcare providers. We're excited to be here.
Well, before we get into what restorative pain care actually is, talk about your history, your background, and then why bring this program to Adams County. Let's start with those questions first.
Well, my background is originally I went to internal medicine, but then switched to anesthesia. I was going to be a cardiologist, but switched to anesthesia, and part of anesthesia specialty is something called pain management, and specifically interventional pain management. I trained in Boston and basically started my first practice in Findlay, Ohio. But the reason Adams County is appealing to us is that as a company, PMG is our parent company. We're very active in trying to be politically active in this whole opioid crisis. We were involved in helping create House Bill 93 and its amendments. So we're very politically active. We've known for a long time that there is an opioid crisis. And the reason Adams County is important is because it is part of the epicenter of Ohio, if not the nation, for this opioid crisis. So we've not only active in trying to be responsible in terms of passing legislation to promote safer practice management of these type of patients. So we are excited to be here because there is a need here.
So let's talk then, if this is where the need is, what does restorative pain care mean, and how does that relate to this opioid crisis, and how you can help work on that?
Sure. Well, we see two groups of patients. One group of patients are usually patients who have new onset pain problems and new onset spine problems. People who have new herniated discs and looking for an evaluation and treatment for such. And then we have patients who have chronic pain issues, either have had surgery of some type, spine surgery, and sometimes those patients don't get better, and they need some kind of treatment. Well, some of the misconceptions that you can only treat them by treating the patients with opioids, which is totally not true. There are many other treatment options besides just opioids. So with restorative pain management, we try and restore function back to the patient, whether they have a new onset spine problem or other pain problem, or an old chronic pain problem. Most likely what we see is spine-related issues. So we try and restore them back to a higher level of functioning, reduce the amount of opioids or eliminate the opioids that they're taking currently. So that's the goal behind restorative pain management, is to restore a better level of functioning and restore a quality of life issue for a lot of these patients who have been nothing but have had medications as a treatment option. Well, there's more things than just medicines out there.
So when you're talking about different treatment options for things to help restore function, are you talking things like physical therapy? Is that what you're referring to?
Sure. What we do, is we practice in a very balanced way. For example, if you have a chronic low back problem and you've had surgery, well, they're going to need some amount of medicines to help control some of their pain. And a lot of this can be accomplished without opioids. Pain to treat muscle spasm pain, medicines to treat nerve damage pain. And we use a lot of physical therapy to help improve their level of functioning, to get some of the muscles in their spine stronger, to prevent further injury, and also to help improve the current level of functioning so they can do more, so they can go to the grocery store, so they can mow their lawn or do other yard work, interact with family members. So to get them functioning at a higher level through a combination of physical therapy, some of our interventional procedures that we use to help diagnose where most of the pain is coming from, and then often minimally invasive techniques to make it last longer, combined with medications. So yes, physical therapy is just one component. It's a very important component to what we use over here to get our patients restored to functioning at a higher level.
It sounds like a lot to go through. When someone wants to come and see you, what's the procedure for deciding how you think you should proceed for their treatment? Do you have to look at where the pain is located, the type of pain that it is? What are the different things you look at a patient to design a treatment plan for them?
Sure. I mean, a lot of it goes back to getting a detailed history and doing a physical examination. And once that's accomplished, we outline a treatment plan for them, which would include either getting certain x-rays or MRIs of the spine, if you will, and incorporating physical therapy while we're getting this information back, maybe getting a nerve test done to see if there's any nerves that are damaged, and then some of the things that we do by injecting certain nerves or joints or even part of the disc to find out what's causing their pain, what's causing most of their pain. Is it a joint? Is it a nerve? Or is it a disc area? Because there's not much there. There's nerve, there's mechanical pain, a joint, a nerve pain, which is electrical problem, and then soft tissue, which is disc or ligaments and muscles. There isn't much else there. So once we can figure out what is it mostly by numbing these different structures up by doing different procedures, we now have an idea. Oh, this is mainly a joint problem. Let's focus on this joint, control the pain from that joint, and eliminate that as best we can so we can get them off these medications and get them more effective physical therapy so they can get stronger faster.
So you said this is a new program here in the area. You've only been in here about 6 weeks, but it's not a new program holistically as a nation. There have been people working on this for quite some time. What is the success rate we're seeing in these kinds of new therapies that pull away from opioid-based painkillers in helping to stop the spread of that opioid crisis that we have? Right.
And everyone's different, but we work for a company called PMG. They are probably the largest provider of pain care services in the nation geographically. We're in 7 different states. And what we do is we are the only company that manages and monitors how well we're doing, how well our patients are doing. So we track a lot of data in terms of our outcomes. So we know how we're doing by tracking this data. And in general, these are general numbers. We can get very specific and would take a lot longer. But in general, patients, once we identify what's causing the problem, we can reduce their pain by about 75% in about 75% of these patients. So our success rate is high. And we know it's high because we're the only ones who follow our own data. So we do track our outcomes, and we do have great success, provided we have a patient who's committed to our program and truly wants to get better.
That sounds amazing. You said 75% of patients feel a 75% reduction in pain. I can't imagine those numbers are any better for anybody who takes opioids just as their only form of pain management, because they need those opioids to stop feeling pain. This can help you stop feeling pain more regularly and without all of the side effects and the horrible addiction that comes along with it.
Horrible addiction and horrible death. And not to mislead anybody, it's not that 75% of patients get better. It's the patients where we identify where the pain is coming from. If we can find where the pain's coming from, we can help about 75% of those patients.
Okay.
So the ones where we can find the cause, we can help them tremendously.
Now, is it sometimes difficult to find the cause of that pain? Is that a problem for many patients?
Sure, and sometimes it's impossible. So we cannot help everybody. We cannot cure everybody. But the ones where we can help with, where we can identify the problem, we can help them tremendously. They may not be 100% better, but they're going to be doing a lot better than they were when we first got them.
Have you seen a large group of people who are interested in this new pain management from the Adams County Regional Medical Center area now that you guys have gotten started?
There is a lot of interest. And one of the obstacles that we have, one of the challenges of this area is that it is the epicenter of opioid crisis. And these patients who've been on opioids for a long time at high doses with other medications, sometimes it's kind of scary for them to have, to go through a change. So we understand that, there is some fear of the unknown. What else is out there? I feel like I'm stable on these medicines, but what they also don't know is some of these combinations can be potentially dangerous. So, that's why opioids have become the number one killer in people between the age of 18 and 25 in the nation. So, let's stop that. Let's reverse that. And this is one of the steps we can take to help reverse that.
That's wonderful. And you said P&G, your parent company, has been doing this for quite some time now and with relatively high success, and that's why they continue to do it. And they're trying to branch out and bring more of this to more of the rural areas that have this opioid problem.
It's not just the areas that have opioid problems. This happens to be an area that interests us because we think we can make a difference here. There's opioid problems in multiple areas. We can't go to each and every one, but this is an area we think we can make a difference, and it's a starting point in this region for us. So hopefully we can be impactful and provide meaningful care for the community and supportive care for the medical community at large.
Wonderful. Well, Dr. Ned, we've got to talk more specifics when we come back. I definitely want to hear more about the partnership that P&G now has with the Adams County Regional Medical Center and talk a little bit more about some of the therapies you might have for very specific ailments. So stick around, folks. We are going to come back and do that right after this here on C103 as part of our special 10 a.m. community program with the Adams County Regional Medical Center. Welcome back to more of our special 10 a.m. community program here on C103. Talking to Dr. Ned from the new restorative pain care program that's being partnered with P&G at the Adams County Regional Medical Center. Doc, let's talk about that partnership. You guys said this area interests you because it was the basically an epicenter of some of the opioid crisis in the state of Ohio, possibly the country of the United States of America. What about that partnership of coming to Adams County Regional Medical Center?
Well, just to clarify again, we don't feel like Adams County is the epicenter in Ohio. It's a major area in the Appalachian area of Ohio as an epicenter in general, not just in Ohio, but again in the nation.
Okay.
But the reason Adams County, again, we focus on rural hospitals. And I'm not sure exactly how we ended up here, but there was communication between one group or the other, and we're excited when the opportunity was presented to us. And so the details of how we ended up here, we don't know, but we know we've had an interest in this area for quite a long time. Again, because of the opioid issue in this area of Ohio, but I don't know the details as far as how we ended up here. But I can tell you that the leadership at Adams County Regional Medical Center is amazing. They do a great job, very conscientious, but they've been nothing but supportive of this joint program we have here. They're aware of the situation in this area of Ohio, and they've been, again, nothing but a pleasure to work with, trying to get this program implemented.
Well, 6 weeks now, you've been working with them. What's your experience been with Adams County Regional Medical Center?
Well, what's refreshing is that we're seeing a lot of patients who truly want to get better, and we've had great success in identifying what's causing most of these patients' problems and getting them back on their feet, and them getting some of their life back. That's of quality. So we've had good success here, and it's a learning process. It's a process where we try to get the patients comfortable working with us because we're providing a new type of program here. So I think once we get patients' understanding of what we're actually offering and the benefits of the program, I think you'll find that the success is going to continue here.
So when we talk about what you're offering, some of the things that I would love to know are what are some of the specific ailments that you can treat with this more holistic look at treating pain? Are we talking arthritis? Are we talking spine problem? That kind of thing?
Sure, yes. Most of what we see are spine-related issues, either patients who have not had back surgery or don't want to have back surgery or don't need back surgery, and patients who've had back surgery and sometimes are having more problems. And typically what happens is that one of the more common things that we see here are people who have arthritis pain of the spine, either pre-surgical or post-surgical. And when it's post-surgical, they may have surgery in one area, but they develop arthritic pain above or below the surgical level. And that's where most of the pain comes from after a surgical procedure. And so what we do is we're able to identify which levels are involved, which side is more painful, and then offer them a more long-term option by what's called a radiofrequency ablation procedure. And that procedure is basically using small needles, and these needles are hooked up to a specialized machine. And what the machine does, it basically deadens the pain fibers that are in the arthritis. So we're not fixing the arthritis, but we're able to improve and a lot of times eliminate the pain from arthritic spine pain, either pre-surgical or post-surgical.
That's an incredible, you said it's needles inserted right by your spine, though. That's got to hurt to start off with.
Well, a lot of this is all done under local anesthesia, and patients do really well. So, again, it's something that we're, it's new to the area, and again, it's getting the patients understanding, educating them about what the process is. It does sound scary, no doubt, but in qualified hands, it's a very low risk procedure, and patients tolerate it extremely well.
Now, is that a procedure that you can perform at Adams County Regional Medical Center as part of this partnership?
Oh yes, we're able to perform this here. We have the equipment here to do it. That particular procedure takes no more than 30 minutes to do. Under local anesthesia, they get up and they can walk right out, and next day they can do whatever they want.
Wow.
No restrictions.
That's incredible. What would be the risks involved? You say part of that is you're not actually fixing the arthritis, you're merely fixing the pain. Would there be concerns about if you can't feel the pain, you overextend or you work it too hard and then suddenly the arthritis gets worse? Is that a risk, or is that something?
Yes, sure. No, the pain that we're blocking is purely pain from the arthritis. So if they fracture something or if they herniate a disc, they're going to know it. We're not covering that kind of pain. Because the old treatment for really bad arthritis pain was fusing someone's back or taking the joint surgically. Well, that's really the old way of doing things. This is a much less invasive way. And if they do have improvement in pain symptoms, the books say it may last 8 months to a year and a half. And if the patients feel like it was worth going through, which most of them do, they may get this done once every year and a half or every 2 years. Again, it's a 20-minute, 30-minute procedure, and it can improve their level of functioning by reducing their arthritic spine pain. Now, you can say that we can't reverse arthritis, so three basic things happen with arthritis. Number one, it may get worse slowly, it may get worse quickly, or it may not get worse at all. Arthritis pain is not going to get any better. So we can't reverse the arthritis, but we can reduce the pain that someone has from arthritis.
Which seems like a benefit to their life. If you can't reverse the arthritis, at least you can reverse the pain.
Correct.
So when we talk about arthritis and I'm thinking about the spine, I also think one of the major areas people feel pain is the knees, especially as they get older. What are some of the options you have for patients who feel like pain in that particular area?
That's a great question. And it's very similar to how we treat the spine pain. The technology we use for treating spine pain or controlling spine pain is the same technology we would use for controlling arthritis pain from the knee. For example, it would be appropriate for people who, say, have really bad heart problems or really bad lung problems and they can't undergo surgery. Well, we have an option where we can basically do a test injection by injecting like a numbing medicine around the knee joint to 3 different nerves. And if the pain does get better, we can go back, use the similar technology we use for the spine on the knee joint, where we insert 3 needles around the knee joint where these nerves live, and those needles are hooked up to a machine, and that machine basically deadens the nerve that carries the arthritic pain impulses. So in patients who can't have surgery because of other medical issues and who've had injections in the knee and are not improving, here's an option for them if they failed conservative therapy. And this is still considered conservative therapy because there's no open incision. Again, it takes about 30 minutes to do, and there's no restrictions after the procedure. So this is also true for people who've had a knee replacement, and we don't see a lot of that, but patients who've had knee replacements and sometimes they have residual pain, they're a year out after the surgery, and we're able to basically numb those nerves around the knee joint up, and if they have reduction, we can go back and deaden those nerves even after having a knee replacement. But again, we don't see that as often. But again, these are things that are available in a minimally invasive way that's very low risk, and that may have a huge upside.
Well, yeah, especially if you're having knee problems, and as you pointed out, there are many different reasons why somebody could not have surgeries. If you can suddenly find yourself able to move a lot better because your knee doesn't feel the pain anymore, your quality of life has to be improved.
It would, it would be hard to believe it would decrease.
Right? Yeah, completely understand that. And the best part, and what I keep hearing is, all of those procedures are non-medication procedures that happen to reduce your pain and improve function, and you've done it all with zero medication.
Correct.
That's an amazing accomplishment, especially because the dangers of opioids are numerous and very deadly in some cases. Do you want to talk about why it's important that people get away from those opioid medications, and are there other medications maybe they should be avoiding as well?
Sure. The main things you want to avoid is mixing opioid medications with what we call benzodiazepines. These are drugs that are commonly known as like Valium type drugs or Ativan type drugs or Xanax type drugs. When you mix those two together, it could potentially be a deadly combination where it can affect someone's breathing, and people can die from something like that with that combination. So that's a combination you want to avoid if at all possible. In fact, there are black box warnings about combining those medicines together, and so rather than subjecting a patient to these combination medications, we're able to even use other medicines besides opioids that may help reduce the pain if need be. Medicines like really strong muscle relaxants that usually go along with arthritis type pain. When people have arthritis, the muscles are tight. So opioids don't really do anything for muscle spasm. But if you put them on a muscle spasm medicine that's treating muscle spasm pain, well, you're actually helping some of the cause of that pain. So I think maybe rethinking some of this and educating the patients on some of the benefits of getting off, or the major benefits of getting off some of these combination medications onto something that's more safe is something that we've really spent a lot of time with our patients discussing, because that is a potentially dangerous combination, and one that we avoid prescribing here at Adams County.
Wow, that's incredibly worrisome, especially because a lot of people, I would assume, that have pain problems would be on something that manages behaviors such as Xanax or Valium.
Yes, so because you can see it's something that needs to be addressed in a multifaceted way. Not just from our side, but having behavioral health specialists being involved in patients' care. We frequently refer patients to a behavioral health specialist for reasons like this. What are other options in terms of, besides using benzodiazepines to help control patients' behavioral health issues? Because I'm not a psychologist or psychiatrist, and it's out of my wheelhouse. So.
Right. All right, so let's hope that somebody heard this and said, you know what, this sounds like a great way to restore function to myself, be able to move a little bit better, and get off of this medication that is, could be damaging me in the long term. How do they come by and see you? When are you at the hospital? When can they schedule an appointment? How do they do that?
Well, they can call Adams County Regional Medical Center directly and ask for the pain management department. And we have a team here that'll help field those phone calls and facilitate the referral process, get the patient in. And as our schedule is evolving, we're here every Tuesdays and Wednesdays for the time being. and that schedule may expand. So we're easily accessible. People are here. People are available, willing to help, and want to help. And we're truly here for patients who truly want to get better. We want to help them get better.
Well, yeah. And you sound like a man who's very passionate about making that happen.
Well, you have to be. You know, we're. I think when you meet the team here, we're all very passionate about doing a great job and keeping the patient first, and trying to get them back on their feet and restoring their lives.
But when we talk about this too, obviously one of the things that comes off in people's minds is costs. Do you need referrals? Insurance obviously has to be involved. Do you accept insurance for these kinds of treatments? Are they too new for insurance to be involved to know what these procedures are?
No, pain management has been around for quite a long time, and the procedure I've described have actually been around for quite a long time. The technology has changed slightly over the years and continues to evolve, but the basic procedures have been around for a long time, and we accept all insurances. So I would encourage patients who do have questions is to simply call and ask to speak to somebody in the pain management department, restorative pain care, and we can help walk them through the process. Another avenue is to ask the family doctor, hey, can we have an evaluation at restorative pain care, and we'll be happy to facilitate the doctor's office in getting the patient in. So we're here and willing to answer able to answer phone calls whenever the patient is willing to call.
Well, thank you so much for that information, Dr. Ned. Thank you for coming to our area and helping us out and trying to help people without the medications that are making them worse, unfortunately. It sounds like a really great program you've got.
It is, and I have to say that this is done in a complete team effort. It's nothing that one person can do. So we really have an amazing team here, and you really have great leadership at the hospital. So I think the combination is going to work out well as a value-added program for the community.
Awesome. Well, we want to thank the team. We want to thank you for talking to us about it. And we really hope that hopefully we've reached some hearts out there that could be listening to C103 right now. Dr. Ned, you have yourself a fantastic afternoon now.
Thank you for your time.
And thank you for your time. Well, that'll do it. Talking to Dr. Ned from the Restorative Pain Care Program at Adams County Regional Medical Center. If you want to get scheduled, you can call up the hospital, and they will work you through exactly what you need to go through. When we come back, we're going to be talking to an extra special doctor from one of the family medical practices that's associated with the Adams County Regional Medical Center. That and more coming up on our special 10 a.m. community program here on C103. And welcome back to more of our special 10 a.m. community program here on C103. As promised, we are going to be talking to one of the doctors from one of the family medicine practices that is associated with Adams County Regional Medical Center. Dr. Gerlach, where do you practice at?
Hi, I actually practice at the Winchester Family Medicine site over at 19262 State Route 136, which is next to the First State Bank. And I'm actually a gynecologist there.
Oh, which to me makes me think of the fact that I don't know how long the area has gone without gynecological services. I know there was some at the Brown County hospitals where my wife was going, but now some people have to drive quite some ways away to find that, but now there's some right at home.
Exactly.
How long have you actually been at the Winchester family practice?
So I've been working with the hospital for over 3 years now.
Oh, okay. And I would assume you have a lot of patients from the area who were excited to actually have your kind of services in the area, right?
Oh, most definitely.
So when we talk about gynecological services and what you do, can you tell everybody what you provide as far as, what you can do at that family practice?
So I am an OBGYN. I can provide annual exams. I can provide evaluations for abnormal uterine bleeding, any screening exams, infertility, birth control, and if they would need any gynecologic surgeries as well.
So you can perform surgeries?
Yes. I actually perform them over at the Adams County Hospital in Seaman, Ohio.
So let's talk about that partnership that you have with Adams County Regional Medical Center, because I think that's an important distinction to have. It's not just there's a gynecologist in the area, but it also means you have a hospital nearby where you can perform more detailed services and more extreme cases that could require surgeries and things like that.
Exactly. They don't have to travel out to the big city or anything of that nature. If they need something done, we can take care of it right here in Adams County.
Now, are you personally the one holding the scalpel when you do those surgeries?
Yes, I am.
Well, that's an amazing thing to have in the area, not just someone who's versed in the gynecological services, but surgery services. Can you talk us a little bit about your history, where you come from, and why Adams County? That's going to be a big question I think people want to hear about.
Well, I've been an OBGYN for a little over 10 years now. I come from a small town in Coldwater, Ohio, which is northwestern Ohio, and actually moved to the area because this is where my husband's family lives.
Oh, wonderful. And do you like it as much as you like your hometown, Coldwater?
Yeah, my hometown is a small area as well, and so everybody here has been real friendly.
And Adams County Regional Medical Center is a great fit for you then?
Yeah.
Nice, small hometown hospital. It's got a good feel.
Exactly, and I just really enjoy being able to help out people and give them access to something that they haven't had in quite a while.
Now, when you say help out people, when you say gynecological services and all of that, is there an age range that are your specialties, or do you see everybody?
As long as it's a female, no matter what the age, I can see them.
All right, that's amazing. And but I would assume everybody's got different needs and all kinds of different throughout the ages. They're going to need to see you for many different things. Younger kids are going to see you for certain things, and older ladies are going to see you for other things, right?
Exactly.
Sorry, I'm rambling on.
Okay.
It's so weird to talk to a gynecologist as a guy. Like, I don't know what you do. What about insurance and coverages and everything like that? I know there's a lot of people when they hear family medical practice and how do they get into a gynecologist nearby them. Cost is always something on everybody's mind when it comes to healthcare. How do they handle that with you?
So we accept most all insurances. Since we are associated with the hospital, even those people without insurances, they can sign up for a sliding scale fee. And there's also a program that we have called the Breast and Cervical Cancer Early Detection Program, which helps to fund women who are not insured or underinsured. So even if you have insurance, but still have to pay out of pocket for things, they help cover as well. And it pays for annual exams, mammograms, breast ultrasounds, surgical consultations, biopsies, PAPs, at no cost to the participants. And you just call 1-866-838-8973 and answer a few questions, and they'll let you know whether or not you qualify.
That sounds like an amazing program, and it seems like a very simple program for people who would need to get those exams but have been putting those off because they feel like they can't pay.
Exactly. It's a wonderful thing, and I would like everyone to be able to get the services they need and not have to worry about cost.
Well, and when you talk about the services they need, why is it important for a woman to have these yearly exams? When you're talking pap smears, you're talking mammograms, why are those so important?
So the biggest thing is just to catch bad things before they happen. So the pap test, since January is Cervical Cancer Awareness Month, it helps to catch and prevent cervical cancer, which is a cancer that is usually caused by the HPV virus.
Right, which I know there's also an HPV vaccine to kind of help prevent that. It's amazing that there's a vaccine out there that actually prevents a cancer.
Exactly. It's a really amazing thing. I know there are some worries as to whether or not vaccines are safe, and this one has been out there for over 12 years, and they've done extensive safety testing. and it's recommended for ages 9 to 45. And just although I don't take care of boys are able to get the vaccine as well.
Why would it be important for boys to get the HPV vaccine?
Well, although HPV causes mostly cervical cancer and genital warts, it can also cause other cancers as well. It's also good to help prevent the spread of the virus to the females, to their wives. Or
I guess that would make sense if the woman that they are with is not vaccinated, but they could prevent the spread to somebody else. I think I understand
exactly.
that. So let's talk about cervical cancer. Since you sent this is a Cervical Cancer Awareness Month, dangerous form of cancer, isn't it?
Yes, and it affects young women as well. I've seen it sadly where there's women in their 20s or 30s that have cervical cancer, which can affect your fertility and even take your life if not taken care of.
That's a very sad thing to hear. And of course, with it being so detrimental to a woman's health, early detection would absolutely be something that you want to catch, right?
Exactly.
So, go ahead.
I was going to say, and it's really easy too, just showing up for your annual exam, getting the pap test, and there's even HPV test as well.
Wonderful. Well, and I know you're out there doing great work. You're working on trying to catch this before it starts, talking to women about, making sure they stay healthy, how to prevent this kind of stuff. And of course, it's not just HPV and cervical cancer. It's all the other things that could go wrong.
Exactly. During our annual exams, we also do breast cancer screening. We screen for vaginal cancers and many other problems that women do face.
Like you'd say, like ovarian cancer and so on and so forth?
Yes. Sadly, there's not a good screening test for ovarian cancer at this time, but coming to your annual exam is definitely a benefit in preventing that.
Yeah, I guess there wouldn't be. That's a really internal part. Anyway, but we thank you so much for your time, Dr. Gerlach. I am sorry I have been a nervous wreck talking with you about this. Guys sometimes have this problem, don't we? But we all need to be able to talk about these issues because a woman's health is extremely important, especially when it comes to the things that you take care of.
Exactly. And I don't want people to be nervous to talk about it. It's your health, and we want to do what's best to keep you healthy.
Well, I'll try not to be nervous the next time that you come by and see us, Dr. Gerlach. But we're so glad you're a part of our community. And again, if people want to come and see you, that can be at the Winchester Family Medical Practice. How can they schedule an appointment with you?
They can just call 937-695-0770 and just ask for an appointment.
And one more time, what was the number for the special program that you had going to help women get those exams help paid for anybody who wants to be a part of that program?
It is 1-866-838-8973.
All right. Well, thank you for that. And, of course, thank you for talking to us today. And we want to thank everybody who tuned in today here on our special 10 a.m. community program on a Friday, alongside of everybody who joined us from the Adams County Regional Medical Center. Dr. Gerlach, you go and have yourself a wonderful day. And for the listeners out there, you have a wonderful day as well. Brad's back in the studio next. Trash and Treasure is on the way. We got news at noon. But first, back to the music here on C103.